Okay, good evening. It's 5 o'clock. We actually have a county meeting tonight before the select board meeting begins, but I will open with the script for our remotely conducted meetings. We're using Zoom webinar for our meetings, which allows for the public to participate in the meeting as attendees. Attendees must register to participate. The registration link is unique to the meeting. The registration link can be found in the description of the Nantucket Government TV YouTube live feed for the meeting. People registering to be an attendee must use their names, otherwise they will not be allowed to participate in discussion. Attendees will join in listening mode. They can click the raise hand button if they wish to speak. The chair will call on those who have raised their hands in the order they were raised. If you do not have an audio-capable device, the Q&A button can be used to type a question. You can also call in. The YouTube chat is no longer enabled. Any questions that cannot be verbally asked must be put into the Q&A function. All questions should be directed through the chair. It will confirm member access, starting with the select board members and county commissioners. Christy Ferrantella.
Here.
Jason Bridges.
Here.
Matt Fee.
Here.
Melissa Murphy.
Here.
Okay, thank you. Then I will go through the town staff members that are present. Amy Baxter.
Here.
Taylor Hilst.
Here.
Rachel Day.
Here.
Erica Mooney. Tucker Holland.
Here.
Libby Gibson.
Present.
Roberto Santamaria.
Here.
Janet Schulte.
Here.
Brian Turbot.
Present.
William Pittman.
Present.
We have our town clerk, Nancy Holmes.
Present, thank you.
John Giorgio, town council.
Present.
Tom Dixon from Dylan Fernandez office.
Present.
We have Martha Turk here for the census.
Present.
Grace Hull is here for the Conservation Foundation. Can you hear me? Oh, thank you. Am I missing any? I think I got everyone. The open meeting of the Select Board and the County Commissioners is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings, and as such, the Governor's order supersedes the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted with agenda materials for this meeting, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation. However, we will have public participation as previously noted in regard to the Zoom webinar. For this meeting, the Select Board is doing video conference via Zoom. Is posted on the town website. Please note that the meeting is being recorded and that all attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and to take care not to share your screen of your computer. Anything you broadcast may be captured by the recording. All supporting materials for this meeting are on the town website. We have some meeting ground rules as we turn to our first items on the agenda. We will introduce each agenda item and the speakers. After they conclude their remarks, the chair will recognize people with their hands raised. And please hold until your name is called. Please remember to mute your phone or computer when you are not speaking. Please remember to speak clearly in a way that helps generate accurate minutes. For any response, please wait until the chair yields the floor to you and state your name before speaking. If members wish to engage in a conversation with other members, please do so through the chair, taking care to identify yourself. And finally, every vote that is taken this evening will be done by a roll call vote. And I will turn it over to the Chair of the County Commissioners.
Thank you, Madam Chair. So I'll call to order the July 8th, 2020 County Commissioners meeting. The first item on the agenda is the ratification of appointment of county representative to the Nantucket Planning and Economic Development Commission.
Move approval.
Second.
Erica?
I just wanted to note that for the public who might not know, that the select or the county commissioner rep to the MPDC is the chair, Ms. Ferrantella.
Thank you. By roll call vote, Jason Bridges.
Aye.
Matt Fee.
Aye.
Don Holgate.
Aye.
Melissa Murphy.
Aye.
Christy Ferrantella, aye. So that voted 5-0. And motion to adjourn.
So moved.
Second.
Okay, by roll call vote, Jason Bridges. Matt Fee.
Aye.
Don Holgate.
Aye.
Melissa Murphy.
Aye.
And that passes 5-0. I'll hand it back over to you, Don.
Thank you. I will call the July 8th Select Board meeting to order. I don't believe that there are any changes to our agenda. There was this afternoon one item missing in the packet, but it was in the posted agenda, just to make sure everybody has it. Under citizen and departmental request, we have a home rule petition discussion with Tom Dixon for an amendment, I believe is how it's worded. Under committee reports, we've been asked to put the coastal resiliency update over to next week. So we will not be discussing that tonight. And there may be a couple of additional announcements that I think Tucker Holland is here to make. But I will turn it over to the town manager.
Thank you. So first off, this meeting is being video and audio recorded. And our census coordinator, Martha Turk, is on, and she's going to give an update and a little bit of information about some items that came up last week and some clarification. Martha?
Thanks, Libby. Hi, everybody. I just want to let you know that as of today, our census response rate is just under 26%. The trend is in the right direction, but growth is very slow and the low rate is concerning. For all of those who are listening, a lot of funding and our political representation are at stake for the next 10 years. And in an effort to clarify the message that select board members, town officials, and other concerned residents could be sharing to encourage all fellow islanders to take the census, I just wanted to share a few important facts. First off, the U.S. Census is not the same thing as the town census or street list questionnaire that was mailed this winter. The town census is annual and is required by the state of Massachusetts, I guess I should say the Commonwealth. Responding to the U.S. Census is a federal responsibility. They are separate, but they are equally important. The population count that's based on the U.S. Census is used to determine legislative representation both on Beacon Hill and on Capitol Hill. And so participation ensures that communities have the voice they deserve at the state and national levels. An accurate and complete census count, U.S. Census count, is also the basis for allocating federal funding for schools and healthcare and emergency services and senior services and other community programs. The 2020 count will impact that funding for the next 10 years, and that's another reason why everyone counts for Nantucket, as we like to say. And everyone truly means everyone. It doesn't matter your age, your background, or your citizenship status. If you call Nantucket home and you did so as of April 1 of this year, you count. Whether or not you were physically on the island, if you call Nantucket home as of April 1, you count here. So please complete your form for your household online or by phone or by filling out and returning the form that you will have received by now. Census takers are scheduled to go out into the community, going door to door by mid-August to follow up with non-responding households. So if you take the census now, you won't have to meet with a census taker later. And just in sum, you, your family, your housemates, your neighbors, and our whole community will benefit from a complete count. So please spread the word. And please go to 2020census.gov. Thank you. I hope that's clarified.
Thank you, Martha.
Great. Does anybody have any questions about that? I guess not. Okay. Martha, thank you very much.
Thank you.
I have one other announcement. It's not on the agenda because it just came up today. It's from the Department of Public Works, and we'll get this online. I'm just going to read this quickly. I'll try to summarize. Due to current staffing shortages, postponement of the annual litter derby, and delay of weekly clean team activities due to COVID-19, starting Monday, July 13th, DPW is piloting the pickup of roadside litter collected by the public, you, our volunteer superstars. For the summer of 2020, on Mondays, Wednesdays, Fridays, DPW staff will stop by and remove consolidated bagged roadside litter at the following bike path drop-off locations, and there will be signs put up. This will get online, but they would be a Milestone bike path between Monomoy Road and Pulpus, Milestone bike path at Tom Nevers, Pulpus bike path at Don Allen Ford Crosswalk, Nantucket bike path at Eel Point Crosswalk, and Surfside bike path at South Shore Road. You can drop your collected roadside litter today. Please kindly separate any found recyclables. This is not for household trash or household hazardous waste or anything other than roadside litter. And if we start to see those items appearing, then this program will be over. And there's a little, I'm gonna put a little sign up and get this online. So the clean team, we hope, will be back in action shortly, but they have had to take a bit of a hiatus because of COVID. And that's it.
Did Tucker want to add a couple of announcements?
Yes, he did. Sorry about that.
Hi, thank you, Madam Chair. Just two quick announcements regarding housing. First of all, we recently were redesignated a housing choice community, which is a signature program of the governor and lieutenant governor based on the production we've had over the last couple of years. In addition, the Affordable Housing Trust recently acquired their first properties using the Neighborhood First and CPC funds, which were bonded according to authorizations from last year's annual town meeting and at the polls. These properties are located on Orange Street, and you'll hear more about plans for those coming up. Thank you.
Thank you. Next, we go into our COVID-19 weekly update. Are there any opening select board comments or questions or public comments? Sorry, Matt?
Can we at the end? I'm going to wait, and if he answers it, I don't have to ask it.
Okay,
All right,
sure.
Thanks.
I'll turn it over to Roberto Santamaria now. Thank you.
Okay, so I'm just going to go ahead and do a quick screen share to make it easier, as I usually do. And then here we go. All right, so this week we're going to be doing a quick report, adding a few little things here and there just by a quick background. I wanted to do an overview about how the mask order has been going. We passed the mask order on June 29th, which requires masks in the outlying districts. These are also on the Town of Nantucket website. This should also be in the packet for anyone to review. If not, we can add it later. I know I got it to Erica pretty late. So we originally, when we first started passing this, we had low compliance, especially when it was just the governor's order. But over time, it's really increased the amount of people that are wearing masks. What we've been seeing out there in the reports we've been getting back from the COVID educators is actually that people, they're saying around masks. Very few people are refusing, and then what we're getting every once in a while is a few people saying that they have a medical issue. But on occasion, and I've been getting a few emails, and we've been getting the occasional comment about the authority to pass an order. So I wanted to just quickly go through a quick authority part here, where there are many complaints about it being unconstitutional, where even though there's a lot of case law out there and a lot of information out there about the authority that we have the state's police power authority has been enumerated in the 10th Amendment of the Constitution. That is enshrined in the Constitution, and it is not an unconstitutional thing to pass a mask order. Nothing covers this more than the case of Jacobson versus the state of Massachusetts, where Justice John Marshall Harlan, who is the justice who wrote the majority opinions, wrote this quote that I'm going to read. In every well-ordered society charged with the duty of conserving the safety of its members, the rights of the individual in respect to his liberty may at times, under the pressure of great dangers like COVID, be subjected to such restraint to be enforced by reasonable regulation as the safety of the general public may demand. What does that mean? The local boards of health can pass a regulation in a time of a pandemic in order to curb that pandemic. What was going on at the time that this case came through was actually a smallpox outbreak, and they were forcing smallpox inoculations and vaccinations. So, the masks. The masks are a public health intervention. And these types of interventions are all over the place. We have seatbelts, the reflective strips you see on running shoes, bike helmets, even the ankle straps on a surfboard are considered public health interventions. They're all the same thing. They're all based on the proper usage of equipment. So you cover your nose, you cover your mouth, just like you don't cover the reflective strips on your shoes. You wear your seatbelt, but people don't always pay attention to the rules. But the number of deaths and the number of accidents are still greatly reduced by these interventions. The masks are really important to preventing this along the island. So real quick, this is all in the packet. I'm not going to sit here and read every bullet point because that's we're not in school. So with the testing, right now, as of this morning, we had 2,179 tests, including OIH and Sherburne. 85 of those have been covered by the grant. We're going to be expanding the criteria for the grant in the next week or so. And then of those groups, the private employers have paid for 434 PCR tests, which is huge. And this is also not counting, this is all the ones that we're doing through the hospital. So I know that some of the private entities have hired one of the other corporations that are on the island to do their antibody tests and PCR as well. And a little bit over 150 people that I know of have been done at one of the golf clubs. And I believe another over 100 have also been done at one of the yacht clubs, which is really good. So I want to come back to the metrics. We set these metrics a while ago, knowing that things can get bad. As the population increases, we know that there's going to be cases. We expected this. So we put the metrics in place to prevent knee-jerk reactions, knee-jerk responses. We're hearing everything from postpone the implementation of phase 3 to even sliding back to parts of phase 2, which, if you remember when Dylan and Julian were on one of our calls, they specifically said we would need a lot of compelling evidence to go back against one of the governor's orders. So how do we stand on the current metrics? Well, this is using today's information. We're still currently only at 1.24% positive testing rate. We're well below that 10% threshold in the first one. For the number of individuals who have died, you'll see that we want to keep it below 5%, but it's currently 3.7% of the cases. But don't panic on metric 2. It is just a relic of small numbers. So as if the number of cases go higher, the lower this percentage gets. So the third one, we still have none of the patients completely hospitalized. We still have readiness, we still have capacity, and we're still contact tracing every single case. And we've been very effective at contact tracing them. And one of the things that we've been finding is that of the 27 cases we had as of yesterday, all the 27 cases that we've had, only 2 were result of on-island transmission. And one of them was caught, and both of them were caught through family members, people who they were sharing a house with. And they were both back in March and April. So how are we doing on on outreach? Well, we have the website going out there. We have COVID educators out and patrolling and giving out masks. We had the high school sports teams out there in the Whaler outfit handing out masks, which was incredibly effective. The Health and Human Services staff was out there doing audits. I myself went out on Saturday and I checked a number of restaurants in downtown. I physically went out with a tape measure and I measured this, made sure the tables were 6 feet between them. And I measured every single table at Ventuno, every single table at Kitty's, Town and Queequegs over on the road there, every single table in front of Nautilus. We walked out there with a tape measure and made sure that they were all compliant, and they were. A big portion of what's happening is 6 feet looks a lot closer than it actually is. So when you have everyone full and you have everyone at the table, it looks like everyone is packed in sardines. So one of the big ones that I saw was at the High Line, there was, everyone's lining up on the Hyannis side. It looks like the line is snaking down all the way back to the office. It looks like the boat is going to be packed. But by the time we got on the boat was less than half full. So it just, sometimes crowds look bigger than they actually are. A perfect example was early in the COVID lockdown when we estimated the cases of boats coming off of people coming off of the boat, where to those of us counting out there, it looked like a crowd of close to 100 people when the crowd was actually closer to around 7. It's easy to overestimate the size of a crowd. We have signs all around the island here with mask zones per the order, and we've gotten a lot of positive feedback on that. And we're having a volunteer table that starts this weekend, which will be in front of 20 South Water Street. So I actually mentioned the mascot with the high school team going out there to the executive board of the Massachusetts Environmental Health Association today. And they loved the idea, and everyone was really happy to hear it. And one of them had actually been on the island this weekend and saw it, to the point that they're actually going to spread this information. They're going to send these pictures from Instagram and Twitter out to the membership of MIHA as a best practice. It's a way of getting the entire community involved. It really gets people in. And then as far as our website go, Florencia, Greg, and Libby, and Rachel and I have been working really hard on the website, and especially Florencia has been creating all these images, to the point that Carrie Donnell, who runs the local public health institute for the Boston University School of Public Health, has been using our website as an example of effective information gathering for public health communication. So we are way ahead of the curve in some of the things that we're doing. We've been hearing a few criticisms here and there of how come you're not taking temperatures at the boat on the Hyannis side. Well, one, we can't pass a rule on somebody else's turf. And then 2, if we get if somebody shows up with a positive temperature, a temperature of above 98 degrees, there can be hundreds of ways that a person is hotter than 98. I myself naturally you hit around 99 degrees just because I overheat so easily. It's really hot out there. So a temperature screen is not an effective way of identifying cases and preventing cases of coming into the island. It is more a feel-good thing than anything else. It is symptomatic symptoms that we're looking for, because a person who can we now know that most of the people can be asymptomatic with COVID. They'll be getting on the boat anyway. So the mask intervention is still the single most effective way to prevent the passage. So, and lastly, just in next steps, just continue education, educate. We have to do this throughout the summer and maybe even into the fall. We're going to keep having to educate as much as we can. We as Americans have really short memories on some things, so it's really easy to slide back, and we're going to have to continue educating until we have a vaccine available. And then maintain the vigilance. We're going to have to continue doing the nasal swabs for PCR and maintain information on antibody tests. As far as the newest cases go, the great majority of them have actually been brought in from off-island. When I say the 27 cases, only 2 were from on-island transmission. It's because there were 3 cases where we couldn't necessarily, let me actually finish the share here so I can see everyone. The majority of the cases, only 2 of them were on-island transmission. Only 3 of them we couldn't necessarily ascertain where the person caught it because they weren't sure, and these were early on. And then really the biggest portion of where we are people coming in from affected areas, affected states. And that's the hard one. New York, Delaware, Florida are the 3 big ones for us that we've been seeing cases in. And I say big ones, but like I said, relic of small numbers. There's only 27 cases. So 3 cases being from, we'll say Washington, that's 10% of our cases. So it just sounds like a lot more than it actually is. If we're going to really pay attention to the numbers and to the graphs, one of the things that I would like to do is just, if we were to see the graphs, people think that we're seeing a spike, but really, if we're having a spike, the graphs and cases, what you would be seeing is actually that. I don't know if you guys can see this. It's actually terrible, but for the people at home, you'll see a spike just going straight up. What we're seeing is and this is cumulative cases. What we're seeing is slow progression coming up. So when we were talking about flattening the curve, that curve is flat. We're gonna expect to see cases. We have over 20,000 people on the island, easily. If you've just tried to drive through at 5 Corners, you've tried to drive through Surfside and Bartlett at any time in the morning or after 4 o'clock, you've seen how many people we have on the island. But keep in mind what it would be what we're seeing. We've only been seeing 1 or 2 isolated cases still coming onto the island, most of which are happening because people are coming here already sick and they're getting tested here. Doesn't necessarily mean that they're spreading it here. And that's the important part, slowing down the spread so that the hospitals can keep an eye on it and so that people do not die. The 1 case that we had who did die was actually had severe underlying conditions. So it was unfortunately as awful as it may be. We tried our best in that with all our cases, and we expected to see deaths when this whole thing started, and the fact that we've only seen 1 death is the lowest in the state. And Nantucket, for everyone who's watching, for the board, we can continue this. If you wear your masks, we can stop the spread. We can slow the spread down, and we can continue slowing the spread, and we can keep it to this very low blue line that you're seeing right here. And with that, I think I'll close it and just open it to you.
Jason?
Thank you, Madam Chair. Roberto, that was a great presentation. Thank you. You covered, 90% of my questions, so I really appreciate that. Thank you for doing the restaurant audits. I really appreciate that and all the outreach everybody's doing. I saw some, people were concerned about the high school students going out. That I just want to make sure that everybody knows that was voluntary. It was like you said, very positive thing. Athletic director was involved, and
Yes.
I think that was a really great initiative. Questions for you on your table of your yellow, green, and red. Why is it the contact tracing green? Do we need more people, or is it just kind of we haven't changed the chart?
Sorry, that's actually the chart. That's from the state chart. My apologies. Yes, the contact tracing should be green. We have good capacity still.
Okay, and can you explain the PUI part in when you go to the hospital and you're checking, when you see that as 2 and 3, it sounds like people are hospitalized. Can you explain how that works?
So PUI is a person under investigation. So it could be somebody who has presented to the hospital that is showing respiratory symptoms of some sort. So they're getting swabbed, but they're being monitored. So while we wait for the test to come back, they're considered a person under investigation. They're being isolated. We're making sure that we're collecting their contacts already, so that if it comes back positive, we can hit the ground running and collect that information.
Okay.
We've been lucky enough that the great majority of our PUIs have come back negative for COVID, and sometimes it's positive for everything else. What's happening is that people are being hyper vigilant now. So if they're getting a sore throat, if they're getting a headache, they're showing up thinking it's COVID. And if they have respiratory symptoms, let's say a person has asthma and they get a cold, it actually presents much stronger than it actually is. So they're being monitored as a person under investigation.
Thank you. So would you consider that a hospitalization, or is PUI kind of a subset of that?
No, a PUI is a subset of that. A hospitalization is when a person is so sick, their oxygen saturation can be low, they're having breathing troubles, they're having, circulatory issues, which we now know that COVID causes circulatory issues, things like strokes and blood clots and things like that. Those are the people who end up in the hospital and getting checked in. And a lot of those times, I say a lot because not all of them, but a lot of those times they end up on a ventilator.
Right. I'm sure. And one last question on the tables, the measuring the tables. Thank you for doing that. Are we measuring? I've heard all different scenarios. Are we measuring table to table, or is it back of chairs? What's the 6 feet measuring?
So what we're doing is back of chairs. So if you see Town and versus Ventuno, perfect example, right on the same street, 2 different table setups. Town has 4 seats around a smaller table. So those are back of chairs to back of chairs. But Ventuno is using picnic tables. So nobody is sitting on that edge. So since nobody is sitting on that edge, we measured from the edge of the picnic table to the next edge of the picnic table.
Got it. Thank you.
Matt, then Chris.
Yeah, I was going to ask about on-island transmission, and you covered that really well. Thank you. One question, I probably had 8 or 10 different people come up this weekend with some concerns, which I shared with Roberto and a couple other people and some of it was citizens, some of it was restaurant owners worried about what will happen if they get closed because other people aren't performing. There was a bunch of different questions. So, a couple of my questions, do we have a written enforcement plan of how, if this starts to ramp up a little bit, like right now I feel fine, but if this starts to ramp up, do we have a written plan of how we will handle it? Who does what, when, where, et cetera? That's number one. And we should be thinking about more than just restaurants. We should be thinking about beach parties, house parties. How will we address those? If our bars don't open, what is our plan to address those if they are not compliant? If they're, because everything I'm seeing and we're reading is it's people inside. It's groups of people without masks, large parties, singing, close proximity, all that kind of stuff is very dangerous. And if we may do great downtown, but if we drive it elsewhere, how are we going to handle that? And, and I think, I agree with Roberto. We're not in a spike, but we've just come off our first really busy weekend where there was some stuff that really probably wasn't appropriate, and we'll know more in 2 weeks. So, so do we have a written plan, and, how do we deal with the other stuff?
So I'm sorry I wasn't here last week. I had to do a family matter. But last week, I think I submitted a written plan with that. What it's mostly, more than anything, is we are enforcing against business. We have to pay attention to the businesses. They're helping us in all of this. They've been excellent. So the written plan, I know it has a lot to be desired, but because of a lot of this situation, that's what we're running into. However, with the governor's order that just came out on Monday, they relaxed a lot. The gathering order allows up to 100 people outside, and it allows up to 25 people in an enclosed space. If you're running a business, it allows 8 people per 1,000 square feet. So it really makes enforcement difficult on that one. So for phase 3 enforcement, no, we don't have a written plan yet, because phase 3 relaxed things so much that the phase 3 enforcement is going to be really, really difficult. We have that small written enforcement plan for phase 2, but phase 3 is very difficult. So we have to revamp our way of thinking on that, because a house party can easily be 25 people or less. And if they're throwing it in their backyard, if they have, we'll say an acre of land, and they put 50 people in their backyard, well, technically they're not against the governor's order. So it's really difficult. And what's been happening is the people have been calling dispatch, and then dispatch calls me. So I've been responding to the complaints as we need them. So we have been getting the complaints and responding to them as we get them. But it's definitely it's a different animal with phase 3, and keeping an eye on with the masks, the mask orders. As long as people pay attention to the masks, and when they're out into the spread with people out to the public, we are going to be interrupting that spread, bringing that R number down below 1 to interrupt that spread, to let it peter out. We'll know by Saturday and Monday how well we did this last weekend. And yeah, Matt, I know.
A follow-up, if I could. I mean, I think our main concern, I've been checking downtown on a sort of regular basis. I was going down before 10 or 11. I've gone down a little later. I think our main concern as an island is between 10 and 2. So I would like to see, if there were a plan written, I would like to see who's doing what, when, and where between 10 and 2. I'm not that worried about up till 10 at night, but but I am concerned about later. So, so if we get to the point where we actually sort of do that type of planning, I would love to see that and comment on that. Thank you.
Sounds good.
Christy?
Thank you, Roberto, for all that information. As with others, you answered a lot of the questions that I had. You put out on the spreadsheet, 434 tests have been funded by private businesses. Is it possible to kind of see that over time or weekly, a breakdown of how many are going through the drive-through versus privately funded? And kind of a second question is it possible to kind of see how we're capturing asymptomatic versus people with symptoms?
Absolutely. I have the spreadsheets of everyone who has signed up, so I can, and I save the spreadsheet each individual day. It'll take me a little bit of time to plot it, but I can definitely get some of that. I can get that information to you for over time.
Thanks.
And then how are we capturing the difference between asymptomatic and symptomatics? What anyone who signs up for asymptomatic, I get on those spreadsheets. So it really is a simple math of just subtracting. With that, the only thing that we are seeing is that number also includes anyone coming in for voluntary procedures. So if we'll say they're going in for a gallbladder surgery, they get tested for COVID. So I might not be able to tease that information out, but it is possible to get granular data on that, high resolution data.
And just as a follow-up question, is it possible to know if the positive cases, have those been asymptomatic or people actually with symptoms of COVID, or is that too much information?
So only some, and that's unfortunately because of the small number, only some, I'll say, were asymptomatic, but the majority were showing symptoms. What it really came down to is, unfortunately, they know they're sick when they get here, and they're just getting tested while they're here. And when we spoke, I'm just going to throw out one of the quotes that we got in one of the contact tracing conversations that we had was, well, we flew private, so we didn't expose anybody. We went straight home. That's not the point. So that's just kind of the situation we're up against with that. But yes, the majority of them are symptomatic.
Thank you.
Melissa?
Thank you, Madam Chair, and thank you, Roberto. I'll echo everyone's compliments. I think your report was really great. I also want to thank you for everything you did this weekend in terms of the outreach, both your department and the town, and the enforcement and the checking of everything. I think I'm one of the ones who emailed you with some concerns over the behavior we were seeing over the weekend, and wanted to understand at what point we would make a decision to either delay phase 3 or go back to phase 2, stage 2, or whatever the most recent phase was. And when we would see restaurants closing at 10 p.m. I am with Matt. I think some of the more concerning behavior that we see from people happens between 10 p.m. and 2 a.m. and is, contributed by alcohol use or drug use and just relaxing behavior. So I think for me personally, one of the things that I'm having a hard time reconciling is the increase in population, which I understand would give us likely more cases, particularly since people are coming from new places. But the number of cases that have grown over a short number of days for us with that population is that concerning, right? So we're seeing an increase over a short period of time, but with more people. So I guess, I'm a little bit with Matt in that I'd like to understand, what is 10% really the metric that we need to look at in terms of case numbers to go back on the governor's order? Or are we looking for other metrics that say, in combination with the number of cases over a number of days, that we're seeing more reports of noncompliance of behavior? Or in short, my question is, how do we prevent a spike rather than react to a spike?
As far as the preventing of a spike, we're trying to keep an eye on I know it's a little bit confusing right now. We're trying to get some clarification, but we're trying to keep an eye on the sewage plant because we're getting a significant portion of the island. We're getting a good representative sample, and that's a week ahead of time. And I can see her on here, so thank you, Deanne. You're helping us with a grant application, so we can make that sewage testing a weekly thing, including the Sconset plant. So if that goes through, we will be able to know a full week ahead of time if we can expect a spike. what really ends up happening is, to prevent a spike, when you see, to go back to my chart here, when you're going to look at a spike, you have to feed the virus. So when you're feeding the virus, you'll see a spike originally start, but that spike is based on how many people you're coming into contact with and how many people you're getting sick. So eventually the virus starts starving. So you see the case start leveling out, and then it'll slowly peter off as people get better. What we'll be able to do with the sewage plant that we can see, we'll be able to predict this a week ahead of time. So in order to starve the virus, if we see a spike starting to show up ahead of time, before anyone starts showing symptoms, because you're shedding the virus well before you're showing symptoms. So what we can do is, if we see this spike pending, we can issue something where we can stop indoor dining, or we can, through the vote of the board, you can change liquor times and entertainment times, things like that, and limit things. So we can put an intervention in this area, and we can stop that spike. We'll still see the people who were shedding the virus come back positive. They will start showing symptoms, and they will show up to the PCR and to the PCR testing, and they will show up to the hospital with symptoms. So we will see those cases. But as long as we have something that can block it right here, we won't see that spike continue up. So we'll be able to stop it and then flatten that curve back down.
Follow up. Thank you. Follow up if I could. Thank you, Roberto. So could you help us understand then if, I think one report we had on June 8th showed 160 quote unquote samples of positive testing, or estimated 160 people. And then 2 weeks later we had 0. So how do we interpret that data to be reliable? If we had seen 160, or if we see 160 next week, are we going to take that as an indicator of spike? I'm having a hard time understanding how to use that data.
So that's actually one of the issues that we're running into. Just a second, I'm going to have to find a mask here. Okay, somebody's here. That's actually one of the issues we're running into. We're trying to find out why that happened. Why did we see an up and then an automatic drop like that? Is it a relic of just the weekend or the day trippers or something like that? We don't believe it is. So we believe something may have gone wrong in that second sample to show up negative. So David and I know David has reached out to BioBot to get more information on that. I haven't been able to follow up on that to find out exactly what happened there. It was definitely a WTH moment for us too. So when we got that back down 0, we can reconcile that information. So what is going on here? So once we get that explanation from BioBot, I'll be able to get that explanation into your hands, so that we can better understand it. What we do know is what we were seeing in Boston and what we saw in Washington State when they were having their first outbreak, and what we saw in California with their first wave as well, is that the same sewage program, same sewage testing that they were seeing actually predicted it by a week. So they know it, and it was all done through the same company. So we know it works. So we're trying to figure out what happened with this isolated case here. Unfortunately, I don't have an answer for you right now in this second.
Matt?
Well, I think with David, what I've heard so far from David was that it may have been a timing issue. One was over a weekend, one was a Monday. And there's another scientist working with David who's looking at that. As Roberto said, these are very predictive, and they will be coming 2 to 5 days. Like the first one we had on the 8th took 2 weeks, 2 weeks and change to get here. The future test should get here within, say, 3 to 5 days, which is a lot quicker. So we'll know ahead of time. If it's every 2 weeks, we won't know it's sort of historical and looking backwards. By doing it weekly and getting it back to us more quickly, if there's an anomaly like that, it'll be canceled out because we'll have, 3 of the same in a row or 2 more in a row quickly. We won't be waiting to August. So I think we're heading down the right path. And this is about the best tool we have right now of any. So I know it's one tool, but
it's a hell of a tool.
Christine?
Thank you, Madam Chair. Just more of a comment than a question. I know there's a lot of concern about restaurants of 10 p.m. to 2 p.m., and I feel that concern as well. Just an unintended consequence is if we were to shut down restaurants, then it would move to more house parties where we would have less control. And as we're moving into phase 3, they can have larger gatherings. So I would just be really concerned that we would be pushing people to gather in their private residence and not have masks versus be in the restaurants where we can easily enforce and regulate that. So just to keep in mind, if we were to go backwards, to think through some of these unintended consequences. Thank you.
Thank you.
You're right.
Jason?
Thank you, Madam Chair. To Melissa, your question is a good one. How do we prevent a spike? And in addition to the sewer testing and it's the encouragement and the education, there has to be the enforcement. And we saw all that this weekend. I just hope we can continue that, because if there's an underlying enforcement or a fine here and there for people who aren't complying, then word gets around really quick on this island, and I think people would comply. So if it's a little bit of enforcement and people know it's coming, then the education, the encouragement will work. Thank you.
And then speaking of that, an important way to get a hold of us, it's just on a side note as far as enforcement goes, please email the health@nantucket-ma.gov for everyone out there, because I walked from this weekend to over 500 unread emails, and I currently have 37 voicemails. It's going to take a long time for me to get back to everyone. But if you email the health email, if you email me directly, I may not be able to get back to you for days. But if you email the health email, that goes to everyone in our office. So somebody will be able to get back to you quickly.
Thank you. Thank you for answering all of those questions. And do we have anything additional to talk about in regard to the emergency orders? Did anybody want to talk in any more detail about what's included in phase 3 and the different parts of phase 3? Jason?
Yeah, I think I have a bunch of questions on when does the 100, where and when can that happen? I've heard lots of different things, that it's in different stages, and maybe next week we can dig into more of phase 3 if we think we need to.
Libby?
I was just going to say that right before the meeting, we were having some internal discussion about phase 3 and what is or isn't allowed. And even as recently as yesterday, there were some items that were not updated yet on the state website. But we have Tom Dixon on, Roberto, myself, Amy, and John. We're all having a bit of an email exchange about what is and isn't allowed. And I think we could give a bit of an overview now, and with the understanding that this is dynamic and it is changing, and the understanding even of legislators and people in towns is, and even at the public health level maybe, and even in town council's own office, are having discussions about, does it say this or does it say that? But there are some important things in the governor's order number 44 that are not quite how we understood them initially. So I'm not sure who specifically would want to try to tackle this. Maybe Tom or John, or I don't know. Amy?
Amy, did you have your hand up?
Yeah, I'll give it a shot. And then we can certainly have legal advice on this as well. But yeah, we've been looking over this as well. And as Libby said, there's a lot of layers to this. If you look at kind of how it's talking about public gatherings and outdoor gatherings, again, like we saw in the last phase where we had to figure out what outdoor meant by airflow. We're also looking at enclosed outdoor spaces versus unenclosed outdoor spaces where you can have social distancing. So also understand, you can look at an enclosed outdoor space, say, maybe you think of the brewery, where it's an outdoor space, however enclosed, so we have some occupancy limits there too as well. You know, a maximum of 100 people in a single enclosed outdoor space. That doesn't apply to outdoor spaces, unenclosed gatherings. But if proper social distancing measures are possible, that means you don't have 100 people standing next to each other again. And this does not supersede previously issued sector guidance, meaning, you know, again, another layer. You can say you can have outdoor gatherings, and I have event people coming to me saying, well, can we permit something on a beach? Well, that doesn't mean suddenly you can have a cocktail party on a beach because that's a bar, correct? So, you know, when we talk about sector guidance, we're talking about if you have a catering type of situation, it's seated tables, it's 6 people per table. Those tables are socially distanced. There are no buffets, there are no self-service food, things of that sort. So we can't look at it as just, okay, now it's open, we can have 100 people in an outdoor space, we can permit an event at a public property. We have to really get into this again, into the layers of it, which sector guidance applies to each thing, which type of sports. Again, they discuss certain types of activities as well, but things not allowed are the bars, dance clubs, nightclubs. So nothing of that sort, no matter where it is, street festivals, different types of festivals, road races, things of that sort of thing. So again, I think there's a little more nuance to it, and we should probably present something. I would like to present something more detailed in response to our beaches, how it affects our beaches, how it affects public spaces like Children's Beach. People have asked for permits, things of that sort. How does this apply to this level? Because that group is now wondering, can we have a wedding now? Can we have this sort of permit? So that's kind of what I'm looking at from this new phase 3 order. So it's not as easy as, well, you can have 100 people outdoors now. There are different nuances into that. That's
maybe John, or those are a lot of very good internal questions that we need to work through, maybe with Tom and John, but I don't know if one of them could give a little brief overview of specifically what is allowed as far as we can tell in phase 3, step 1 or part 1.
So if you're looking at phase 3, step 1, the order does change gatherings inside of a building quite a bit. As you know, since March, it's been no more than 10 people. There was an exemption in the original order, as there is now for a town meeting, but this does affect the meetings of municipal boards, including the select board. So now, under the new order, indoor gatherings are limited to 8 persons per 1,000 square feet of accessible indoor floor space, but never more than 25 persons in a single enclosed indoor space. So that tells me that you, I don't know whether the board has considered how long you want to continue with remote meetings by Zoom, but certainly this order would not change the ability of the board to continue to meet, to have remote meetings. If you try to meet in person, there's no real way that you can predict how many people would want to show up at that meeting. So the board could meet in person and with the appropriate social distancing with staff, but you're going to have to continue to have access to the meeting by the general public. The order also changes specifically with those capacity limitations that would apply to private space, but specifically backyards are exempt. So the way I read this order, at least right now, is any number of people could have a party in someone's backyard and not be subject to this order. And so that is I don't know if that's going to become a problem on the island, but I think that's something that you should keep a close eye on to see whether any further orders might be appropriate locally. Because under the governor's order, outdoor space is not covered by the capacity, specifically backyards are not covered by the capacity order. I'm not sure if the board has any questions about that. There are there are specific prohibited activities that are, I'm sure, of interest. Street festivals, agricultural festivals, walkathons, road races, bike races, organized athletic events. So those kinds of things are still prohibited. And then the face covering order, I believe that's still, that hasn't changed from the governor's previous face covering order. As I mentioned, the local legislative bodies, the general court or the judiciary, are not subject to this latest limitation on gatherings order. But I would certainly concur with Amy. There are a lot of nuances here, and you can't just read the one order. You have to look at the whole series of orders to determine what exactly is permitted and what isn't.
Thank you, John. Question, Jason?
How much time do you think, Libby, John, Amy, do we need till next Wednesday to really dig into this? Even if we can't meet again for the select board, if it could be sent out to everyone, if we did get clarification from the state, or if we just figured it out on our own by Friday or Saturday. It's going to be hard for, if people call dispatch and then Roberto gets a call, backyard party, if there's 50 people, it's okay as long as there's social distancing. It seems very problematic and a little cloudy.
So, go ahead, Pete.
I was just going to jump on what Jason said there too, as far as what we need to determine. I certainly, from my perspective, want to determine very succinctly how we apply this and what the policy is going to be for, again, the beaches. Are we updating that policy for our public spaces, events, indoor type of things too, as well, so that we properly communicate that? And that probably also should be obviously tied up with, backyard, if you're going to do anything more with that. But we would like to see a kind of concerted effort to make sure we define our public spaces appropriately in the next week with this guidance.
John?
And I would just point out that the Board of Health's Emergency Order 12, which is the mask order, that only applies to places that are open to the public, whether indoors or outdoors. So there's a gap there. If you did have that 50-person backyard party, that's not a space that's open to the public. So the mask order of the Board of Health would not apply.
Thank you, John. Is that regardless of whether it's in the old historic district or not?
Well, the mask order issued by the Board of Health only applies basically in the Ford district in Wisconsin.
Okay. Is there anything more on that currently? Shall we move on to the human services update? Taylor?
Thank you for having me. So tonight I'm going to talk about what our mental health agencies have been seeing during COVID-19, and also provide a bit of comparison to what their numbers looked like at this same time period last year. So focusing on April through June thus far, and then also share on food resources available on Nantucket. So firstly, to kind of go over what a safe place, which provides services to victims of domestic violence on both an emergency, such as meeting a victim on a police call or at the hospital, and also on an ongoing basis through counseling and court advocacy, what they have been seeing. So in April, they saw a 34% increase in clients served versus April of last year. And additionally, they had 7 calls to their 24-hour-a-day hotline versus only 2 in April of last year. But they did see less clients at the police department, 1 versus 2 in April of last year. And they also didn't serve anybody in a court setting due to them being closed. Then going forward into May, they had a 13% increase in total clients served compared to last year, and experienced 5 calls to their hotline this year in May compared to 6 last year. They saw absolutely no difference in amount of clients served at PD and served 1 person that they met at the hospital. Whereas last year during that time, they didn't serve anyone at NCH. Again, courts were largely closed, but they did assist 1 person in an emergency setting. Moving forward into June, courts started to reopen, and they provided court advocacy for 6 people last month. And again, identical numbers to the May comparison. They had a 13% increase in June of this year as compared to June of last year. They had a decrease in hotline calls, having 4 in June of this year as compared to 6 month of 2019, and they served 2 clients at police and 2 at NCH, where at this time last year they served 1 at police and none at NCH. So overall, they have seen an increase. It was more dramatic in April than it was in May and June. Gosnold is our local agency that provides mobile crisis emergency mental health evaluations and gets called into the hospital when somebody is having a behavioral health emergency. And they provided me with data on April through the first week of May of this year compared to that same time period last year. So in that period last year, they had 7 crisis evaluations, and that resulted in 2 inpatient hospitalizations, 1 3-day respite stay, and 3 outpatient referrals, and 1 person declined services. There was a significant increase in crisis evaluation during the same time period this year, with 17 evaluations being done, which resulted in 10 inpatient hospitalizations, 1 respite stay, and 6 outpatient therapy referrals. So you can see the overall acuity of that increase during that time, as over half of the evaluations resulted in an inpatient stay during that time this year, whereas during that time period last year, it was far less than half that had that result. And finally, Fairwinds, which is the counseling center, provided me data on what they have seen in April, May, and June of this year, though not a comparison to what they saw last year. So in April, they completed 5 51A filings, which is when a mandated reporter files with the state when child abuse or neglect is suspected or reported, and then they initiate an investigation. They had 5 clients that they considered to be kind of in crisis, and had 2 instances where they either issued what's called a section, which is an involuntary hospitalization for behavioral health reasons, or requested a well-being check on a client. They collapsed the data on those 2 things. And then they also delivered 634 overall hours of clinical services to their clients. So that doesn't just include kind of standard outpatient therapy. It also includes medication management, in-home therapy, family therapy, couples, and also therapeutic mentoring, which is a great program that they have for kids. Moving forward into May, they again did 5 51A filings. They had 2 clients in crisis, and also 2 for whom they either issued sections or well-being checks, and offered 598 total hours of clinical services. Lastly, most recently, this past June, they completed 3 51A filings had 4 clients in crisis and issued 5 either sections or well-being checks, and their numbers increased to 712 total hours of clinical services. So a lot of good work being done. So the good news is that Fairwinds does not currently have a wait list for therapy services, and they're able to assign people calling for services to a therapist really quickly. And they also have a wonderful program offered in the evening, which is essentially a behavioral healthcare walk-in clinic, though right now it's a call-in or Zoom-in clinic. So this is a program that the town assists with funding through CRC grants, and it's totally free of charge. It's first come, first serve. And it's really great for people who are either struggling or kind of on the fence about whether or not they need mental health services. Until I accepted this position, I was one of the clinicians that staffed it. So I know how many people it has helped either get into more services that need it, or just people who kind of needed 1 or 2 services to work through an issue. So I would really encourage anyone who is struggling or is considering getting help to try it. You just call and request to be seen, and they'll schedule you. It's the most user-friendly way to access that. It's really, really wonderful. So anyone out there who needs it, please call them. It's there. Does anyone have any questions on that, or I can move on to food resources?
Anybody have questions? Oh, go ahead, Taylor.
Okay, thank you. So we have some great food resources that are specific to Nantucket, and then of course also access to more traditional supports. So the Nantucket Food Pantry, which is operated by the Nantucket Food, Fuel, and Rental Assistance, they've switched over entirely to a no-contact delivery-based model, and they dramatically increased their capacity. So right now they're serving 313 island families. This is a big decrease from last month, at which time they were serving over 1,000 households, but it does still represent a decrease from June of 2019. So the numbers are still up, even though it's not nearly as significant as last month. Right now, they're currently operating out of the school, and I know they're very, very grateful to be able to use that space. They needed more room during this time, and prior to that, they were able to operate out of the White Elephant Ballroom. So the community has really stepped up to help them. They are working on returning to their former space after the 17th of this month, which is behind the Greenhound building, but they're working with them on being able to use a bit more of the space. Fortunately, it does coincide with the demand going down a little bit. There's an amazing new, really efficient program called Text for Meals, where Nantucketers who have a financial need, the means testing qualification for that is purely financial, they can access free meals on Mondays and Thursdays, mostly for pickup, but delivery is an option if you need it. And this program is sponsored by the Community Foundation's Nantucket Fund for Emergency Relief, and it's available in multiple languages. It's a really, really, really great program, and I know that it's being very well utilized. There has been some confusion about whether or not senior hours at Stop and Shop were continuing, or if they were going to move them to coincide with the opening of the store, which is now 5 a.m. at the out-of-town location, but they have committed to continuing to offer senior hours at the original time, which was 6 to 7:30, so that seniors and people with health conditions can use it too, have access to the store when it's the best stocked and when it's the most clean and ideally quiet. And Bartlett's also offers this service every day between 7 and 8. So we're really, really happy that they've decided to continue with that instead of eliminating it. And for anyone who's not aware, the out-of-town Stop and Shop now has the separate entrance and exit, with the entrance being on the produce side. Last time when I talked about senior meal delivery, I said that it was wrapping up. However, we actually wound up extending it in a modified format through today. So though I said this last time, I'd really like to reiterate our thanks to the owners of Sandbar or the Whale, who are our partners in the Saltmarsh meal delivery, Nick and Jamie Nass and George and Emily Kelly, their chef, Manny Rojas, and he was often assisted by Amy Young of The Beat and Aaron Zersher of Crew, really stepped up to help us when delivery services weren't nearly as prevalent as they are now, and get seniors meals. So we're really, really grateful to them as well as to Brooke Moore. She played a huge role, and the Nantucket Fund for the Community Foundation's Nantucket Fund for emergency relief, and we are discussing that if there is a resumed need in the fall, reinstating, if not necessarily exactly this program, something similar. So again, thank you to all of those wonderful people and all of the volunteers. There's a program called WIC, which is the Special Supplemental Nutrition Program for Women, Infants, and Children, and Health Imperatives, which is the local agency that helps people access that resource, has seen a 26% increase in their active caseload for this program compared to June of last year. That's a little bit down from last month, where they had a 29% increase. So these electronic benefit cards are accepted at both of our Stop and Shops, and they're really fast about getting people enrolled if it's a needed service. SNAP is another program, which stands for Supplemental Nutrition Assistance Program. Those cards are actually accepted at Bartlett's and Stop and Shop, and the Nantucket Cottage Hospital Social Services Department can assist island residents with the application process. And then, like I said, the last time I gave a food resources update, Meals on Wheels continues as per usual, delivering meals to island seniors that qualify 5 days a week, and just does an incredible job with that. So all of this information, along with links and phone numbers to access all on our website, and people are also more than welcome always to contact me directly, and I'll help them find what is the best fit and get them to the appropriate resources and walk them through it to whatever extent is needed. So please don't hesitate to reach out to me directly as well. Thank you.
Taylor, thank you so much. That was really comprehensive, and there's so many good things that have been happening throughout this entire crisis. Any questions or comments from anybody? Jason?
Thank you, Taylor, for having this update. It's good to keep this in front of us and for the public to know all the great work that's happening. The question is there any discussions, which I'm sure it's hard to do right now, for the fall and the winter and the spring? Are people making projections of, I think we're going to have another hard off season where a lot of these numbers are probably going to go up? Are we starting to look into that? Are all the different entities and nonprofits kind of looking out on the horizon of what's coming?
Absolutely. I think there's very much a surge expected, and I think that people were hesitant to access resources during the height of the pandemic. I think people didn't know what to expect and were scared, and that there's a kind of a bit of a residual reaction once you kind of get through it and can take a breath. So the hospital, Fairwinds, et cetera, everyone up to the, the Community Foundation in terms of funding are all expecting a potential increase in need, though we don't yet know. And then as people reopen for more in-person services, also those numbers going up, because a lot of it has been telehealth and not everybody is comfortable with that. Additionally, for example, if you were attempting to access resources at a safe place, telehealth when you're potentially in the home with your abuser wouldn't make the most sense. So as places reopen for in-person services, there is a surge expected.
Thank you. Shall we move on to an update on restaurant liquor licenses and change of premise for outdoor dining? Is there anything new to report, Amy?
No new locations. I think all the comments covered before. I was out this weekend too as well, and late as well, and saw the same things. And I think everyone's really, for the most part, doing their best to figure out this new normal. So I know they are working hard at that. I'll take any questions, but no new additions to what we've already reviewed.
Does anybody have any questions?
Less of a question, more of a thank you to Amy. I know that you sent many emails this weekend reminding the restaurants of the rules and guidelines, and it's just so important. And I'm begging all restaurants and retail and every business to comply, because we don't want to see one or two really ruin it for the rest of the economy. We've all worked so hard to get our economy kind of up and going as much as we can. And I don't want to see us go backwards because just a few don't want to comply because of a busy weekend. So it's just a beg to the restaurants and a thank you to Amy and your staff and everybody that did so much hard work this weekend.
Thank you. Yeah, they did. The majority, I'll just speak for the majority, really are trying. And a lot of them, I did speak to some that maybe we thought we had some issues with, and they are trying their best too as well. So I would give a kudos to most everyone that are really trying to figure out this new normal. So thank you.
Yeah, and they've also done an amazing job with the aesthetic. I mean, downtown really looks really nice. Everyone keeps saying it looks like very European, and it's just a nice thing that's come out of it. Matt?
Yeah, I was going to say the same thing. I think it looks great. Customers and restaurant people really love it. And so I've been sort of saying, don't blow it, guys. Don't mess up this year if you want to have a chance of doing this again with or without COVID. I think it looks amazing down there. There's things we'd have to figure out, but we could do that. I will say, I know that restaurants are reaching out themselves to some that are, sort of slipping. And I know that's happened, and that's a good thing. But they're asking for help. They're asking for people between 10 and 2 and, getting some enforcement. So that's one of the things I mentioned earlier. And that's important. I will say, I can see it something natural. The customers are getting it now, whereas sort of 3 weeks ago, 2 weeks ago, a lot of them didn't have masks, maybe a third didn't have it, and they'd cover their face with their t-shirts, and they didn't quite know what we were doing. They are all kind of, for the most part, 95, 99% compliance, and they are learning, that they can't come inside and that things are different, and they're figuring it out. So I do think it is a process. It was for us, and we've been at it for 3 months. It's going to be for some of the restaurants who are really just starting now. But as long as they know they have to, and they will, and they'll be successful.
Thank you. Oh, Jason?
Yeah, I think it's been, I've heard people say it's been effective for, I believe it's the High Line. As you're embarking, they go on the loudspeakers. It might be all the boats that are saying, here's what to expect with the mask order. I've gotten feedback from day trippers who've said that to me in our businesses, that they heard that before they even got off. So I think that's great. Thank you for all the boat services for doing that. And today there was an artist pop-up at the Jersey barriers at the Chicken Box. So we had local artists painting the Jersey barriers. So go check those out. They're really cool.
Do we have any additional PIO information?
I've got a little bit, and on the Jersey barriers, Jason, thank you. That's a really great idea. I'm glad that was happening. It does. There was a jump the curb incident on Main Street over the weekend. I think you all might know about it, but that sort of emphasizes the importance of having Jersey barriers around, even though they are hideous. Okay, so PIO report. Just a few things. We issued a couple of press releases. The COVID educators are starting. We've got a great response on that. Same with the high school students. Some slight concern about the high school students, but as Roberto said, it seems to be endorsed by state agencies, public health related. The COVID volunteer table that we've been talking about, we've got something up on the website. I think this was mentioned earlier, for people to sign up. I think maybe Taylor might have mentioned it, but hopefully we're going to get some people to sign up. And just, if you're interested, take an hour or two at this table. We had a radio request for someone to talk to WBUR about July 4th concerns. Janet took that one. Our Instagram account has grown significantly. We had 1,400 followers in March. Today we have 4,000 followers, a 186% increase in followers. We have over 1,000 views of our Instagram stories daily, and the face coverings have been the most shared and liked postings. So Florencia is hopefully out there watching. We thank her very much because she's really creative with the stories, and they get out there very, very promptly. So we're trying to really get things updated as quickly as we can. town services update. Not too much to report on this. We are starting to look at appointment only for some departments. And that can work. Some departments are already doing that. They might be doing it outside. They might be doing it inside, but it's kind of slowly starting up a bit. And buildings themselves, for the most part, not all, but most of them are not yet open to the public to just come in, but we are helping them remotely. On Monday, the courts are going to open back up again on the second floor of the town building here. And so that is a bit of a concern for us because we do not really want people wandering around in here. So we're going to be talking with the courts about that, and we have begun those discussions. The RMV is not open still, and I think our most recent information was they are hoping by end of August. And Tom Dixon, I don't know if you are still on, if you have any additional information about that. Do you want to say anything?
Yeah, unfortunately, not too much additional information. That's what we had heard as well. I can say that Senator Sierra and Rep. Fernandez are working on it, and there possibly could be some kind of temporary location or something maybe worked out if the town was interested. But that needs to come from the RMV, and hopefully we can make an introduction through the town to that as a possibility, but nothing else to add.
Okay. Thank you, Tom. We have a potential idea about that, but it is going to heavily depend on social distancing and availability of space. And obviously, town space is at a premium, especially with the social distancing needs. And I think that's it for the public information town services update.
Thank you. Melissa?
Thank you. I want to add thanks for the great outreach and social media jump. It's a wonderful tool for businesses to use and share the town's messages to their followers and their clients. So it's really important messaging to keep up with. And I hope we can see one for that COVID educator volunteer sign up too, because I think there's a lot of people in the community who are willing to get out there and help spread that good word about wearing masks. So I'm standing by ready to share that too myself.
Okay, next we'll move into public comment for anything that's not otherwise on our agenda for discussion, non-COVID-19 related. I'm not seeing any hands raised. If anyone does later, we'll get back to you. No new business, approval of warrants and pending contracts. We have treasury warrants and one pending contract.
So move.
Second.
All those in favor by roll call: Matt Fee.
Aye.
Melissa Murphy.
Aye.
Jason Bridges.
Aye.
Christy Farentella.
Aye.
Scott Holgate, aye. Those pass unanimously. Then we have citizen departmental request, Nantucket Conservation Foundation, a request for approval of concerts for conservation series. Grace, are you on? Do you want to give us a little overview? Oh, you're muted.
Oh, sorry. Thank you. Can you hear me okay? Thank you, Madam Chair. We have brought forth a proposal to have a drive-in concert series at the Milestone Cranberry Bog. The thought is it's very much set up like a drive-in movie theater, except there would be a live performance. Within the proposal, we have a couple of different dates, which we may need to change depending on artist availability. We don't have any contracts at this time yet. Parking would essentially be in the area where parking takes place for the Cranberry Festival. All the vehicles would be socially distant with rows in between to allow for emergency access. If you look at the map that I had put together, you'll see there's also roads kind of going around also for ease of leaving at the end as well. Ticketing would be done all online as well as as well as entrance into the Cranberry Bog. You would enter the same way you do for the Cranberry Festival through the service entrance that allows us to check in people individually and send them to their assigned space. This is a screenshot from Google Earth on the day of the Cranberry Festival. So while the tents are in the lower right-hand corner, I have just left them up there. It's simply for placement and size reference, so you know where they are. We have placed restrooms down in the red boxes along the bushes. And whatever number the town recommends, we will get those numbers of restrooms. And then we also would bring in a number of food trucks, 3 food trucks, which are placed in blue boxes as well.
Thank you. Does anybody have questions? Oh, Amy?
Yeah, I'll just follow up kind of what we have been doing in the review and what the recommendation is for various departments. And as we put in the summary here, just obviously similar type of guidelines as in the drive-in theater as far as social distancing, kind of concessions and how that works too as well in those lines, restrooms and payment options. They have been reviewed and are under review, like Grace mentioned, with the fire department, making sure emergency vehicle access and their emergency plan is fully vetted and approved. They're in that process. Health department as well as the number of portable toilets and the mobile food unit area and any temporary permits that need to be done. A police detail, they've actually mentioned they might do more than the one that has been required for something of this sort. And then any permits for any tents or any sort of building of stage may be required. So those things and inspections would be required for final permit and before they execute the events.
Thank you. Any questions, comments? Christy?
Just a question with this being allowed in phase 3 as a concert and outdoor, is that something that we've reviewed and thought about?
Yes, and again, I still have to figure out the intricacies of it, but it would be mostly an outdoor music venue. It's a combination of drive-in guidelines and outdoor performance. Right now, certainly we need to kind of go over the fine details as far as if folks are, and we have to do this as well with the Dreamland Drive-In, if folks are to view from outside their vehicle, how would that look? Where would they be placed and how they would be distanced? That would still be required as far as social distancing, but I believe it would be the drive-in theater itself, which is movies only, but that was phase 1, and now outdoor performance venues. I think the combination of those both with all of the sector guidelines can be applied here in all areas.
Anything else? Jason?
I'm supportive of any business, nonprofit trying to be creative to survive right now. So I'm supportive of it. And I know public safety and Amy and everybody has dug into this and go through all the right processes. I just think that it really won't be a drive-in. Like if it's a concert and the music is good, people will want to dance, and they're not going to probably dance in their cars. So just how do we think through that? Whether there's, it's successful and it can continue to go on, in the things like this in the fall, and that's my only thing that I can't visualize how that would work. But I support it.
Melissa?
Thank you. I agree with you, Jason. I think there's some good important details to be worked out in terms of safety protocols, but I think the idea is one I can get behind and support. I have also gone to see concerts and live musicians where you just sit and enjoy the music. And so I don't know who the artists are, but I think that, with a strong messaging from the Conservation Foundation on how to enjoy the music safely, people will just be really excited to have the opportunity to be out and do that.
Grace, did you want to respond to that?
Yes. One thing I didn't mention is that these concerts will be scaled, stripped down, acoustic, 1 to 2 members of the band. So this is not a full-on rock concert. I mean, people may want to be dancing, but this is very dialed down.
Is there a motion?
Motion to approve, once Amy's kind of figured out any of the remaining details that need to be figured out.
I'll second.
I'll second that.
We have faith in Amy.
Oh boy. Okay, thanks.
My only comment, I can't help it, is I hope this goes better than anyone else that's tried to do concerts out here. I warned Cormac. I said, this is the kiss of death, Cormac, but I hope you overcome it.
Okay, with that, let's vote. By roll call, Matt Fee,
Aye.
Melissa Murphy,
Aye.
Jason Bridges,
Aye.
Christy Ferrantella,
Aye.
John Holgate, aye. That passes unanimously. Thank you.
Thank you.
Next up, we have Tom Dixon here to go over an amendment to a home rule petition.
Thank you, Madam Chair.
Thank you.
Good evening, members of the board. So we received back with some technical amendments after working with Michelle from Mr. Giorgio's office, some technical amendments on the home rule petition for the water company's merger. And all it is basically some technical stuff that the bills on third reading committee had flagged, some real technical things, making sure T's are crossed and I's are dotted, et cetera, making sure everything's legal and in compliance, not in conflict with other laws, and et cetera. And so we got this amendment, worked back and forth with town council's office, and it was amended into to a point where it needed to be approved by the select board because the current draft is different than what passed town meeting. So that's what's before you this evening for your approval. And on your, if you do approve it, the town clerk will send a letter we'll go through me to the bills on third reading, and that will show that the town has passed the amended petition. And then the rep can start moving it through the House and hopefully get it done by the end of this legislative session.
Thank you, Tom. Anybody have any questions or concerns? Is there a motion?
So moved.
Is there a second?
Second.
All those in favor by roll call, Matt Fee,
Aye.
Melissa Murphy,
Aye.
Jason Bridges,
Aye.
Christy Ferrantella,
Aye.
John Holgate, aye. That passes unanimously. So go forward. Thank you, Tom.
Thanks, Tom.
Now, and the Coastal Resiliency Advisory Committee recommendation has been put over till next week. Now we move on to town manager's report.
Thank you. So first off, we have the 4th of July follow-up, which is usually an annual event after the 4th of July from the various departments. I think the chief can speak about police, but in the meantime, fire reported calls for service were down 31 calls over 2019. Engine calls for service were down by about 7. Activity for the weekend was similar to past years, with the largest change from last year in EMS calls. That was reduced by 29 calls, or about 63%. The chief was out himself on Saturday night for inspecting fire code violations, and the fire prevention officers were out on Sunday. He reports that businesses were compliant with the fire code, or with a couple of, or some issues that were brought up that were immediately corrected. And there were no major fires or incidents over the weekend. And I think the police chief has some information about the police calls. And I don't know if I think Roberto pretty much covered the weekend for the health department already. But if there's additional, okay.
Okay, thank you, Libby. The police department, we had our 4th of July detail, minus the state police. We only had 2 troopers this year that assisted us. The rest of the department, we had our traffic posts set up, our checkpoints set up. The beach traffic was significantly less than prior years. Everything about 4th of July this year was less than last year even. Last year was considered a very calm year. Overall, we had 12 arrests or arrest situations, of which only 3 were actual in custody arrest. And the good news is none of them were for disorderly or alcohol fueled problems, other than 1 OUI that came that night. Compare that to last year, where we had 16 arrests, and most of them were for disorderly, public consumption, things like that. So that was significantly down. Our calls for service were just slightly more than half of what we had last year. Again, notably, most of them, we had 48 calls for loud parties. Many of them were at the beaches. About a quarter of those calls involved fireworks. Some of those were probably multiple calls on the same fireworks situation. You compare that to prior years, we had a lot fewer loud noise complaints the prior year. So what our observation was what before was a lot of large group parties was this year more a lot of at home, in people's backyards, those types of parties, rather than the large group events that we've had in the past. So I think from a police perspective, it was a very successful 4th of July, the kind of 4th of July we'd like to have every year, in some sense. That's all I have.
Thank you.
Thank you, Chief. Sorry, I think Janet has a quick report too.
Well, unfortunately, we didn't really have a 4th of July this year because we had canceled all our Main Street and Children's Beach activities early on. And the rain, you know, as it turned out, the rain would have been prohibitive of people coming into town. And the fireworks have been postponed to New Year's Eve. I do think that, you know, this was the really most successful year we've had for not having water balloons on Main Street in a long time. And I'm really happy about that. We continue to show steady progress in fighting that fight.
Thank you, Janet. Is there anything else? Anything from any board members? Okay. Libby, annual town meeting. Oh, Christy?
I was just going to ask how the beaches were, if they hit capacity, or how that was for the police department.
None of the beaches reached the car capacities that were established. Matter of fact, we had an arrangement with the Land Bank and Conservation Commission and the airport to monitor all the different beaches with actually putting a person there and count cars. And by midday, they were saying, we're going home. There's no reason to be anymore. There, you know, I would say the South Shore beaches were probably the busiest of the beaches, but none of them were anywhere close to prior year capacities. And I attribute that a lot to the fact that we had bad weather that morning, where a lot of people would have gotten started earlier. I think by 10 o'clock, nobody had maybe a dozen cars on it. And normally they would have had probably 50 cars on it by then.
It was kind of cold and windy on Saturday, which was probably somewhat helpful this year for social distancing. Yeah. Next item, I think.
Okay, thank you everybody who was involved with 4th of July prep. The next item has to do with the 2020 annual town meeting, the election, and then going forward regarding the next town meeting, and as an aside, some pending significant capital projects. So there's some material in your packet that I just wanted to go over. Regarding the 2020 annual town meeting, I am in the process of writing up the usual summary that I do, sort of outlining who needs to do what. And just to summarize, of the 117 articles that were on the warrant, 76 were voted as recommended. 39 were passed over to go to a future town meeting. Of those 39, 22 were citizen articles. 2 articles were called and then voted on as recommended. At some point, if not tonight, the board will need to determine at which point we are going to have the next town meeting. Will it be a special? will we just go to the 2021 annual? And there are definitely pros and cons for both, which I'll get to in a minute. I wanted to just mention, because this hinges on some other things, the 2020 annual town election. So of the 7 ballot questions, 4 passed, 3 failed. Questions 1, 5, 6, and 7 passed. Questions 2, 3, and 4 failed. And just quickly to remind everybody what those were, question 1 was an override for Our Island Home. That actually passed by quite a bit. There was a debt exclusion for Newtown Road transportation improvements. That did not pass. Question 3 was reconstruction of Lover's Lane. That failed, very close, but it did fail. Question 4 was a debt exclusion for improvements to Amelia Drive and Waite Drive. That failed, again, pretty close. Question 5 was a debt exclusion for construction and improvements to the Children's Beach Stormwater Pump Station. That passed by quite a bit. Then there were 2 capital outlay exclusions for equipment, vehicles, things of that nature. Article 6 passed, and Article 7 also passed. However, on all of the ballot questions, as we know, the companion warrant articles were passed over. So action was not taken on them at town meeting. So there's some issue with the ballot questions. We could potentially put up to 3 ballot questions on the federal election ballot in November. However, towns that wish to do that must request permission from the Secretary of State's office by August 5th. So we would need to make that determination by then. And there may be some benefit to doing that, although those would still need, again, the companion town meeting vote of approval. So there's that issue with the election. Just for sort of concurrent consideration, we do have a number of pending, what I'm calling significant capital projects that were either being already considered for a fall town meeting before COVID ruined everything, or we were in the process of starting to discuss when to put them forward because they were needing to be brought forward at some point sort of soon. And those include the physical facility of Our Island Home, the senior center, Nantucket sewer extension, seasonal town employee dormitories, municipal facilities, and the DPW facility. So with regard to the next town meeting, and I know the moderator is on and the town clerk is on, and we have all had some discussion about this, as well as the director of finance. There are just some considerations to think about when we're considering scheduling the next town meeting. For this coming fall, September and October are a bit problematic with respect to COVID concerns, which probably are going to be still around, and national election preparations. Nancy and I had a discussion yesterday afternoon about this, and there are going to be early voting requirements on weekends at town halls, which is going to impact the resources we have for a town meeting. And we wouldn't be able to do a town meeting on a Saturday if we also have early voting on a Saturday, I don't think, but Nancy can speak to that. November and December, I guess might be possibilities. That is getting late though, with setting the tax rate and with other competing priorities that are going on at that time, like the fiscal 22 budget and the 2021 annual town meeting. It's always hard, not impossible, but hard to get a special town meeting at the same time as those things. But of course, we've done it before. There probably are going to be public concerns about the length of time and the length of a warrant that would be causing a large group of people to be spending time indoors together. And we could potentially, I guess, open up additional space at the high school. We have not really had a deep discussion with the school about that or the technology department, because opening up rooms beyond the gym and the auditorium is going to be a large project, and it is going to be potentially costly and have a lot of logistical issues, especially if we will have e-voting at the same time. So one of the thoughts was to consider holding everything until the annual town meeting for 2021. I didn't get a chance to firm this up with John, but we also have a quorum requirement for special town meetings, 3% for transfers, 5% for appropriations. And John, I just didn't have a chance to touch base with you or Brian about what the current allowance is to reduce the quorum requirement. So that might be something that might help a little bit, I guess. But depending on what would go on a special town meeting warrant, we might expect a public response. I don't know if maybe the town clerk or the moderator or even you, John, or Brian would want to comment, maybe starting with you, Nancy, about a fall special and what it would entail.
Thanks, Libby. Well, we do have a very busy fall slated with a week of early voting prior to the September 1st primary, including one weekend, and then 2 weeks of early voting prior to the national election, November 3rd, which includes 2 weekends, including Saturday and Sunday. And then the Secretary of State's office will also be mailing a mail-in ballot application to every voter in the state. So we expect to be busier than we've ever experienced with mailed ballots. So those times are obviously very busy. My number one concern about the fall town meeting, besides people being together, is really the schools. And as Libby said, we haven't had an in-depth conversation with them about that yet. But for example, the gym floor, when we had it ready for the town meeting, has to be covered. And we were able to get 150 chairs in there. We were able to get about 180 or so, maybe 185 in the Mary Walker, which gives you about 330 voters. So, you know, as Libby was saying, do we need more space? And that presents a technology problem. And I'm worried about the school being able to allow us to use the gym in the fall, because obviously the kids might be. So there's a lot of complications there with space and the time to clean before and after for the students.
John?
So the legislature passed a special act that basically says during the governor's COVID emergency, as long as that's in effect, the select board can vote to reduce the quorum requirement at any town meeting. So it would apply to the special or an annual town meeting. But it has to be not less than 10% of what your regular quorum requirement is. The select board has to publish a notice of its intent to consider that 7 days before a meeting, and then the board would vote to reduce the quorum. So that is a possibility even at a special town meeting in the fall. I'm assuming that the governor's emergency declaration will still be in effect. And then I don't know, Libby, whether you, I think we need to talk about the override and the debt exclusions and what kind of flexibility you have. So with the debt exclusion that passed, there's no particular time for voting that appropriation at a town meeting. And you could wait until the 2021 annual town meeting to do that. The only risk would be if prices increase and then if you wind up with a significantly different amount for the appropriation, you may have to repeat that debt exclusion. But barring that, you could wait until the 2021 annual town meeting to vote that appropriation. With the Our Island Home override, you would have to call a special town meeting to change the funding source for Our Island Home if you wanted to take advantage of the override vote that did pass at the annual election. And that has to be done prior to your setting the tax rate. If you waited until the 2021 annual town meeting, you would then have, and your tax rate obviously would be set at that point, you would then have to repeat the override at the 2021 election. So those are my comments.
Thank you, John. I don't know who to go to next. Brian could at some point speak about the Island Home budget issue and some other potential budget issues that we may be facing in 21 and 22. And maybe Sarah could speak about her thoughts if you wanted to, Sarah.
I don't actually have any thoughts. I feel like we just finished this meeting, and it's very hard to think about a meeting in the fall. There are so many unknowns. But if you decide to call a meeting in the fall, I will be there and help to make it work. But I think it's going to be tough, particularly given the commitment that the select board made to bring forward all of those articles. It would end up being a very big warrant unless we could get people to agree that we could put some of those off until the annual, because I think a lot of those articles really merit discussion at an annual as opposed to at a special, particularly if we're talking about a reduced quorum. I'm also worried about suppressing participation by only having such a small number of seats available. I think we got away with that for this past annual because we only dealt with the most essential articles that were necessary to keep the town running, but I'm not sure we can really justify doing that for a future meeting. I'm a little worried about that. I would feel uncomfortable urging people not to come to another town meeting, quite honestly. So I don't know, that's not really helpful, but those are my thoughts.
Brian, do you want to talk about the Island Home?
Sure. So, as John mentioned, if we weren't to have a special town meeting, we would have to redo the process with the ballot vote and then the authorization at the annual town meeting for the funding of the Island Home budget. A special town meeting, I mean, obviously the later we go, it gets more and more difficult to set the tax rate. We try to set it, we have a deadline to get everything to the printers to get the actual bills out for the third and fourth quarter by the middle of December. And we typically try to set it right around the first week of December. It would certainly be doable for my staff to do, but there would be some additional pressures. One of the concerns that I had talked to Libby about recently was the fact that, which we confirmed with DOR today, that we will be okay. We did not receive the CPE money that we typically receive, that we do not budget, but generally creates retained earnings for our Island Home. We did not receive that by June 30th, which I discussed with Libby yesterday. And I reached out to DOR to confirm whether or not we could count it as a 90-day receipt, and provided it was received by September 30th and prior to our certifying free cash, it can still be counted as a fiscal 20 receipt, which would allow us to certify and have it available to be used in the budget process for fiscal 22. That was a concern that we had, given the fact that we have gotten the commitment that we are supposed to be receiving it, but it hadn't been received by June 30th. If we hadn't received it, it certainly would have created a little bit of a larger gap for us, because it wouldn't have been able to be certified until July 1st of 2021, which would have created some additional funding issues. Again, as I had mentioned when we made the presentation back in May with the revenue changes, given the way that we have funded the Island Home, which is entirely with free cash and retained earnings, we are certainly in 21 going to have to identify a solution to fix to fund the $5 million. I don't believe that given the slowdown in receipts and some of the collections, that we are going to generate $10.3 million in free cash again in fiscal 21. We probably will most likely generate a substantially lower number, probably closer to 6 or 7 million, which will certainly put some stress on our ability to fund all of the operation of Island Home without some alternative, be it having a special town meeting to try to change the funding source to allow for the override to be enacted prior to setting of the tax rate, and or going through the process of asking the voters to approve the override again with the fiscal 22 budget.
There was some talk at one point about the potential of an August meeting, late August, before school goes into session, if school goes into session. Are there any further thoughts on that?
I think that we had a more recent discussion with the school, and they are going to be flat out the last 2 weeks of August dealing with whatever is going to be coming at them.
Okay. We couldn't ever have town meeting in the VFW, could we?
I don't think it's big enough. I mean, I shouldn't never say never, but I don't think it's big enough for one thing, especially with social distancing requirements. And there are some regulations that would have to be, I mean, there are regulations for elections being held there. Some of them may be similar to having a town meeting in a space like that. It certainly has good parking, but I don't think it's big enough.
I'm really concerned with not doing something in regard to the Island Home funding. Matt?
Yeah, I think if we're trying, I think people reached out to me after the vote. They thought it was a one-time $5 million vote, the way it was written. They did not believe it was a permanent override that is growing at 2.5% a year. And so I think that there'll be some people out, regardless of whether it's this fall or this spring, to voice their concerns with it. I don't think it's a slam dunk that we hope, or some people hope. I've consistently said, I think we have work to do when we get our work done, and we're talking about some of it tomorrow. When we get our work done and know what changes need to happen and how we're going to do it and where we're going to go and what we're going to do, I think it passes very easily. But I don't think we're there yet. And I think it's premature and takes the pressure off us to do the right thing. So anyway, I've said that all along. You knew it was coming. Sorry.
What does everybody think? There's a lot of articles still sitting there. Christine?
Yeah, I think I'd be concerned about trying to rush something for this fall or before December, and just not knowing all the uncertainty with COVID of how many people would be able to attend. And I think some of these issues are too big to try to suppress the number of people that could attend. So I'm almost more in favor of waiting till 2021 and putting it back on the ballot and hoping that it has the same success that it had this year.
Jason?
I would, my preference is to do something this fall to clean up some loose ends, regardless of where it goes. I understand the problem with the schools, but won't we have the same problem with the schools in April? And COVID could be here next April too. So I don't know there's a big change from this fall to early spring next year. We just don't know. So I think moving it to, I think this, what you said, Christy, could be happening in April as well at an annual town meeting. So I don't really know what the answers are. I'm sitting here trying to figure out what's the best move, and I'm not sure.
Why don't we have a conversation with the schools and try and identify what possible dates there could be and space there could be. And I don't know if maybe we want to start pulling some of the citizens warrant articles to see if they would be willing to push their stuff off further. as long as they didn't have to get signatures all over again. There's 39 articles left. It's a lot less than what we started with. But if we then reopen a warrant for an annual, we're going to have another 100 articles potentially. And there may be a couple of other reasons that would necessitate a fall town meeting that we may be discussing. Christy?
Those questions for Sarah, Libby. Have you heard from other towns or any kind of facing a similar dilemma and heard what they're doing or what they're thinking about doing?
I don't know if Sarah has or not, but there were some towns that haven't had their town meeting yet. And so they basically have to have one in the fall, unless they have that 1/12 budget, which can that go through the entire fiscal year, Brian?
I think it would only go until you have a budget set. At some point, you'd have to set a budget so that you could set a tax rate to be able to mail tax bills. So I would go until a community has set their budget for fiscal 20, I would imagine.
Depending on the weather, I suppose some towns were considering outdoor town meetings, and that, I think we wrote that off a long time ago because it's really problematic unless you have a really specific setup. John, I don't know if you know, in answer to Christy's question about other towns having fall town meetings, do you know?
I have 4 annual town meetings in September to go. I'm not aware of the towns that did hold an annual town meeting in June. I haven't heard of any calling for a special in the fall, but that certainly is possible. But I know about half of my towns are waiting till September to have their annual town meeting. And I also had 2 outdoor town meetings.
Jason?
Madam Chair, I like your suggestions of trying to see what options there are for the schools, really putting something out there. Maybe half of or maybe 2/3 of the citizen warrant articles don't mind to be pushed to the fall. I think that would help us make a decision. And I know early November would be a cold outdoor town meeting, but I'd much rather bundle up and be outside than be indoors. And so I don't know if that would, with the storms that we get in November would make sense, but maybe outdoor in April, I don't know. That's not great weather either. It's something to think about.
Well, we gave outdoor quite a bit of thought when we were trying to plan the June town meeting. And in addition to weather concerns, the technology setup outdoors lends itself to not having it very much. So no screen, no e-voting, none of that.
Maybe the Dreamland will let us borrow their screen.
I mean, I thought the June town meeting worked very well. I felt like it was handled very well, but we'd have a bigger turnout if we have all of these 39 articles that may have more discussion. But I think it's worth a little bit more investigation and discussion. We don't have to make a decision today on anything. We do have to make a decision by our meeting on July 22nd if we want anything on the November ballot. That is the big looming date. And then there are also other dates that we have to meet in terms of scheduling a town meeting. But the most pressing right now is that that we have to make a decision on any ballot questions by July 22nd. Right, Libby?
Yes.
So I don't know if you guys want to talk a little bit about whether you want to revisit any of the articles that failed. I don't know if there are going to be any other options coming. I think that there are some things proposed at the federal level for road improvement funding that I don't know if we might be able to get funding for things like Amelia or Waite or Lover's Lane through those programs that are part of the stimulus. Just throwing those thoughts out there. Jason?
I'd like to bring Lover's Lane back because it was so close to 13 votes, but it could be done at an annual town meeting. Doesn't have to be this fall.
Matt?
I agree. I was surprised Newtown Road and Lover's Lane didn't pass. They were close, but didn't. I'm glad the stormwater did. That shows me people are paying attention. But what I worry about is that Lover's Lane and Newtown are a sign of what's going to happen. People are tightening their wallets right now, and they're a little concerned. And I think, hopefully the summer continues great and everything goes great. But even if it does, I think people are not feeling, they're feeling the pinch. There's a lot of people who out of work for a long time and are, sort of trying to catch up and are not going to catch up this year. And I just think that we're going to have to be cognizant of that in any financial discussions we have going forward. I think we have to be cognizant that not everyone is doing well.
Okay, well, again, we don't need a final decision on that until the 22nd. So those are kind of the big decision points. If we're having a fall town meeting, how we're going to do it, when we're going to do it, what's going to be on it, and if we want anything on the November election ballot. It is a good opportunity to get a huge voter turnout, would be just one point since it's a federal election. But I think that we can probably move on to the next agenda item unless anybody has anything else. Oh, John?
I just wanted to mention that the capital projects, if you think that having a large turnout at the state election would be a better temperature of the community, you could have the ballot questions in November, but wait until the 2021 annual town meeting to do the appropriation for the ballot questions. I'm sorry, for the debt exclusion questions.
And the timing would be okay on that.
Yes, I would think so.
What if we were to put the island home override on again? Would then it line up better with, or does that not really help?
I don't think that really helps.
Okay.
Because you have a positive vote on the override, and so the only limit you would have to hold the town meeting before you set the tax rate. There's no need to redo the override unless you wait till after you set the tax rate, and then you would just put it on your annual election warrant next year.
John, would we be able to, I know one of the issues with the ballot question for the island home had to do with the fiscal year. I guess, could we do it for fiscal year starting fiscal 22 in November? It would be a kind of a redo.
Pushing it out a year, right?
Yeah, well, yeah, and then it would have the it would need the confirmatory vote at the annual in 2021. Maybe we can think about it and report back.
Yeah.
Yeah, let's get a little more information for next time. Okay, select board's reports and comments. Review of a draft response to an open meeting law complaint. John, did you want to make any comment on that, or?
We work closely with Erica, who was extremely helpful, and you have the draft response in your packet. The bottom line is a lot of the issues that were raised in the complaint, we determined were not really open meeting law questions. They were more about the process that the board has used in the past and whether the current cycle complied with that past practice. But those are not open meeting law issues. I think the two issues that were raised were the specificity of the notice, we thought that we looked at it and we thought that the notice that was part of the agenda for both meetings was more than adequate to meet the requirements of the open meeting law. And then the other question was the manner in which the board took the votes. And in both instances, the actual vote of each select board member was read into the record publicly at a posted meeting. So we don't think they were secret ballots, and we think they complied with the open meeting law. The one difference was at the second meeting where you reconsidered your vote, we did that in real time, which I think actually worked better. I wouldn't concede that the way you did it the first time violated the open meeting law, but I think going forward, depending upon how long we're in the Zoom environment, I thought it worked quite well myself. And then each board member confirmed their vote verbally. But the bottom line is we don't think there was an open meeting law violation for either meeting. And that's what the draft response that's in your package says. So if you authorize us to file that, we will do so.
Thank you. We do have a hand raised. It's Mary Warrow, who actually filed the complaint. So I'll let her make a comment. Mary?
Sorry, NCTV is going to have to let her in because I don't have permissions tonight.
Okay, can I just set this aside and we'll move on to the next agenda item and come back to it once we sort this out? Continuation of discussion update as to racial equity, race relations task force and community forum. Rachel.
Hi, good evening. In some ways, I don't have much of an update, but what I can say is that we have really had some really great conversations going on that have really been driving a lot of the discussion. So while on paper or actual action tasks that have been done, I don't have too much of an update there, but I can tell you that there is a lot of communication going on, not only internally with town groups and personnel, but also with members. There's a community group that's been developed. So the first item that I can discuss is the RFP. We did have a meeting with the Nantucket Employee Empowerment Team today, and they discussed this a little bit. And a lot of the questions were really great, but it really reminded me that not everybody knows the language of RFPs because it's sort of second nature to me and many people who work for the town at this point. But explaining what a request for proposals is and how you put out the bid and why there's certain things that are a part of that that are really important. So we do want to make sure we continue to have a review of this to make sure we're really capturing what we want. So what normally happens is upon the bid going out, whatever responses you get, even if they're not the greatest, but they meet your comparative criteria, you're sort of tied into this now working with a certain vendor that maybe there's somebody else that provided a much better response, but it wasn't what you asked for. So people are getting a little nervous, I think, that we're not asking for the right things, or is it not detailed enough? And that making sure that when we do get this response back, it's really encompassing what we want, not only as the town, but in terms of the community as well. We also have had some discussion of who is reviewing this. There's normally a typical makeup of approximately about 5 people that involves the department involved, procurement, finance. And so it's usually, 1 or 2 people that has expertise in the area. And some of the discussion has been, do we have representatives from employees or NEAT? Do we have representatives from the Council of Human Services, along with other members? So there's a lot of discussion going around how we actually get this involved and what it's saying. One other item that's been coming up a lot in discussion is trying to balance people's expectations of what this is going to provide us. Some people really do believe that we have a drafted job description, it's ultimately ready to go. Should we wait on that while the results come back for some type of plan related to the results of the RFP, or should we start the process now? And so that's one of those other discussions that's sort of happening, and what is the right balance to make sure that the next step that we take is the right one. So NEAT is meeting again. We had a great discussion today. They are going to discuss a little bit more of the comparative criteria and the deliverables. And a couple things else that came up with them was if there are any other community data groups or assessments that are done right now, besides a couple public forums, it doesn't look like we are taking that into consideration. So they wanted to add that into to make sure that if there are other efforts going on, we tie into that data because it probably will be very beneficial to us. In terms of the equity office, like I just mentioned, there has been back and forth about whether we start advertising the position now or whether we wait. Both sides make very valid points about what's the best next step. And I think one of the things that we might do is we could advertise it under the job description that people have reviewed, but it doesn't necessarily mean we have to hire. Like we don't have to necessarily hire somebody right away unless we do get the applications in and it seems like the best fit. One thing that I know that we've been talking about is race is a very big driver and why we are doing this right now. But what we wanted to do with this diversity equity office is it encompasses all protected classes too. So that's, I think, something else that's being discussed and taken into consideration. And what I mean by that is it also considers sex, LGBTQ plus discrimination and inclusion, age, disability, genetic information, other ethnic minorities, color, religion, and so on. So I even mentioned in a separate internal meeting today that I have been following a few other places, and it seems that they're even tying in things such as physical traits like hair to make sure that there is not any kind of discrimination or difference in treatment related to people of not just the law-defined protected classes, but overall. So this could really be a lot bigger than basically the driver of why we're here right now. And again, we still have the functional challenges to figure out with the job, where they fit in the org chart, office space, things like that. But we're sort of thinking that we could tackle those issues and advertise while the RFP process isn't going. Another thing that I know we have talked about is a development of an equity advisory board. So the Council for Human Services was sort of tasked by you all last time to, once they start meeting, to help draft a mission and what the makeup of that board could be. And some of the discussions have surrounded maybe making it similar to the Contract Review Committee, where they're a subcommittee of the Council for Human Services. They have 2 representatives from Council for Human Services, and the other members are appointed by the board. The conversations we've had have really taken some interesting turns. And, one thing that we're really hearing a lot of is, trust. Trust is a big word that keeps getting bounced around there. So it might be good to have a select board appointed advisory board, but is that going to help us build the trust with the efforts that the group might do? And so one thing that has been talked about as well is maybe it is actually more like a task force. It's not a formal select board advisory board, or maybe there is both. But the reason why the task force conversation has come up is because it is not necessarily specifically town-led. It would look similar to what the Behavioral Health Task Force has done, so that we can tie in a lot of different entities in the community, such as the school, different nonprofit organizations, and also community groups that might also be doing steps and working towards getting some information and tackling this issue in our community. And so I think how all this plays out, a lot of the conversations we're having is, where is everything interwoven? Where can we support each other? And where is it that the town truly needs to go versus what a community group or somebody else can provide to us, and how then to use what the community group or other groups are doing to help build the trust in the town, because that is a common theme that we're hearing. And some of this stuff as well relates to, even if we get results from the RFP, is that somebody that the town's hired? Is there still going to be a thought that there is some bias there in whatever plan is developed? And how then do we incorporate that with other groups? So this is where the task force concept has sort of evolved. And one thing that we were sort of thinking is that if they did get developed, while they don't have a decision-making authority, they certainly could come to the select board and say, here's what we're doing, here's what we're working on, and what that makeup is. So I know Jason and Melissa have been great in conversations as well. And so I don't know if they have anything that they want to add to some of those discussions that we've been a part of. But I do think that we have started engaging a little bit more communication with some community groups in their efforts. And so I think what we're really trying to figure out is who's taking the lead where and what makes the most sense. We probably will start advertising for the position, but again, it doesn't necessarily mean we will hire right away. And one of the things that we're talking about with the development of the request for proposals is even if the Council for Human Services is going to start meeting as of next week, they're a new board. They need to figure out each other a little bit, mesh. And this is a really big task for a brand new board that doesn't have a lot of experience with boards and all of that coming together. So we don't want to overwhelm them right from the gate, but reviewing the RFP might be a great way to kind of start getting them to gel a little bit better. And that process will take a little bit of time too. So I think there's concern that we're not hitting some short-term tasks right away, but then there's also some concern that we need to give it time. And so that's what we're just trying to balance right now.
Thank you. I think Matt had a question.
That was it, but yeah, sorry.
Just a question or a thought. One of the questions that I was thinking through is if we hire a position, there could be an advisory board to that position that doesn't have to be us. Coastal Resiliency, we have a Coastal Resiliency director, but he has a Coastal Resiliency board, which has, sort of broad representation with a couple scientists, et cetera. So maybe there's a way to, because I think part of it, if they're saying it's the government or the board in that trust issue, well, maybe we keep people who have concerns involved in some sort of manner like that.
Melissa?
Thanks, Dawn. And thank you, Rachel. I think you did a great job summarizing the complexity of trying to tackle the appropriate next steps for the town to take in its role. I just want to support the idea of advertising for this new position sooner rather than later, and not being in a rush to fill it with just anybody, but to see what kind of applicant pool we can attract and what that's like first. I think if we are really lucky, we may find a very special candidate for that position who can actually help inform a lot of these next steps. And if we don't find the right person, there's no harm in trying, and we can just, wait and repost the position later. I also think that there's, great community efforts that aren't really ready for prime time yet, but that are in development, and that gives us some time to see where those go and how to balance our next steps with the community response. But I'm fully in support of putting the lure in the water, so to speak, and see what kind of great talent we might be able to attract.
Thank you. I agree with what's been said. And I really appreciate these efforts, and it's really great to hear that we're getting a lot more feedback from the community. And I hope that it all continues. I think we'll continue this conversation. Can we go back to, Erica, were we able to fix getting someone in to speak?
Yeah, so I'm gonna let Mary talk now.
Okay, I'll go back to you, Mary.
Can you hear me now?
Yes.
Okay. Just going back to the comments by town council. I have provided the board and town council and town administration with some responses to town council's proposed submission to the Attorney General. And I just want to very briefly review those. Just to clarify, my concern is with the conduct of the meeting on June 17th and the meeting notice that was on June 17th. That's the topic, that's the subject of my open meeting law complaint as it exists. I do believe, I agree with town council that the vote, the methodology for the email vote that was taken at the board's special meeting on the 29th, in my view, remedied the previous vote, which I still believe was not in accordance with the open meeting law. But the board has enacted a remedy to that, which is perfectly appropriate. I do want to address the issue that town council brought up about his view that the complaint does not address violations of the open meeting law, but rather violations or changes or departures from the board's own policies and protocols. And in my comments that I filed today, I do address that, and I find it very disappointing that the board would essentially say, we really don't care that we didn't follow our policies and procedures. We believe that we met the bare minimum standard. I don't agree with that, but I also think that the board should be held to the standard that it sets for itself. And this view, I think, is also reflected in the advice given by the Attorney General in earlier public meeting law violation complaints that I have filed, and in which the Attorney General made some statements. I also want to clarify that town council seems to be conflating my concerns about the June 17th meeting with my concerns about the notice, the posted notice that was given for the special meeting on June 29th. I have not as yet filed an open meeting law complaint for that meeting. I currently intend to do so when I have gotten more responses to my Public Records Act request, which was earlier filed and which I'm going to expand upon. The concern that I have with the June 29th meeting is that there was no notice in the posting that appeared in the board's, on the board's agenda that public comment would be accepted through email. In fact, that statement was made many times during the meeting of the 24th, and it should have been included in the notice that was posted for the meeting of the 29th. And that's the next shoe that's going to fall on that issue. I am very pleased that the board seems very committed to clarifying and improving its policy for these appointments. And that is very heartening. And that's kind of where we are. I will be, if your board approves this submission and town council forwards it to the Attorney General, I will be pursuing it further with the Attorney General on the remaining issues where I think there are still outstanding my outstanding concerns about violations. And again, I want to say that the email vote as it happened in the meeting of the 29th, I think was that was a remedy to what I regard as a violation on the 17th. So I hope I haven't confused you too much. And if you have any questions, I'll be happy to answer them. I expect you'll be following the advice of counsel, and that's it.
Thank you. How does the board feel in regard to counsel's opinion and whether you would like to move forward with submitting it to the Attorney General? Jason?
Thank you, Mary, for your comments. I'm comfortable submitting it to the Attorney General. I can make a motion, or if anybody else wants to speak.
Matt?
Mary's no longer here, correct? Mary, are you here?
On, I think, but she's not.
Yeah, she's not talking. If I can bring her back in if you need me.
That's all right. I just, I think that I think we've recognized that there were some, I think we recognize we could have done better. I think that the second vote was better than was held better than the first vote. We're learning. I think that there's, sort of room for improvement in that process. And I believe that this board has agreed to do that. And I would like, I'm comfortable voting for this, but I also, I think I think some of it, I'm hopeful that some of Mary's concerns will be addressed when we deal with the process. I feel very strongly that everybody understands it, and I think we will get it right, and hopefully that she will recognize that we're getting it right and that we're trying to do better.
Jason, I think made a motion. Did anyone want to second that?
Didn't I think Mary's hand's up. Sorry.
I don't think Matt said that he didn't need a response on that. Mary? Mary, go ahead.
Well, I would like to respond in any event, and I don't mean to take up your time because you've certainly spent a long, difficult evening. But yes, I certainly do appreciate the effort and the concern that the board has expressed, and what I take to be its clear determination to improve the process. And as I think I said in the letter, my comments are my own personal comments, but I'm also an officer of the Nantucket Civic League, and I will encourage our executive committee and our board, as they have already been engaged in working with the town to collaborate on aspects of educating people about government and making it easy and helpful for people to be able to participate. That's it.
Thank you. I believe that we've slated this for August 5th to get some ideas together for how to better do our appointment process and make the whole process extremely transparent for everyone involved. Potentially rework old practices and be more consistent. So we'll be talking about that going forward. Frankly, I'm just finding it a little bit disheartening to have these kind of complaints filed when we've done so much to rectify the public's concerns. We're in the middle of a pandemic. We're trying to get used to doing this via Zoom. It's a tremendous amount of work and a tremendous amount of thinking through for all of us in administrative and the board, and the amount of hours that we have put in this since this happened. It's just to have to respond to some of these things is just, I want to respond to them in terms of answering the public's concerns. And I feel like we tried really hard to do that, to continue things that we have to pay counsel to respond to in terms of the Attorney General. It just feels a little bit disheartening to me. So I just need to say that. Melissa?
I think I seconded, if Jason made a motion to approve council's letter, I seconded that.
I didn't get the motion. I mean, I heard Jason say it, but he didn't really move.
Why don't we start over?
Yep.
Jason, Melissa, second. All those in favor by roll call: Matt Fee.
Aye.
Christy Ferrantella.
Aye.
Jason Bridges.
Aye.
Melissa Murphy.
Aye.
John Holgate, aye. Thank you. Last item on the agenda are committee reports. Does anybody have any committee reports this evening? Christy?
Tucker stole my thunder at the beginning of the meeting, but my first Affordable Housing Trust Fund meeting as the select board rep, it was exciting to purchase 2 properties and see that cooperation between CPC and Neighborhood First funding. Second update, the plastics committee met via Zoom with a couple of distributors and retailers. So we had Stop and Shop, Cumberland Farms, and I think US Foods or Cisco, one of them. And just kind of an update that this went into effect June 1st, but the enforcement was a little bit relaxed with the pandemic. And as of the meeting yesterday or Monday, pretty much everybody is trying to be in compliance. So we heard from Stop and Shop that they've removed the plastic K-cups and put in compostable K-cups. They're also still looking at a water filling station. It's in the process of, it's on schedule for being installed. There's just a little bit of information we need about if it's allowed, kind of what the guidelines are from the state. And so if it will be operational, we're not really sure yet. They have reduced water bottles. They're still having some trouble with sourcing and the supply issues for getting other alternatives. In terms of the distribution, about what we heard from Jay was about half of businesses are complying and half are still just kind of, again, trying to make it through this pandemic, using up existing stock. And a lot are starting to move over to aluminum cans. And he feels that if we kind of make the message that we're going to start enforcing, businesses are ready to adapt. So that's something that we're just kind of discussing internally, is when we kind of vaguely said maybe phase 3, and now phase 3 is going to last until we have a vaccine. And so just internally, the plastics committee needs to meet and kind of make sure that our messaging is really clear. And then Cumberland Farms said that pretty much they're all in compliant. They're just really struggling with the supply chain issue. And so it was really great to hear that everybody is trying to comply as much as possible, even during COVID, and that we're really moving in the right direction. Thanks.
Melissa.
Thanks. I should have mentioned this during the COVID update, but I was on the High Line on Monday, and they made a great announcement as we came into the harbor about the mask rule on the island, especially in the 2 districts. And their messaging while I was on the boat both ways was just fantastic. So I want to again thank our transportation companies for all their effort that putting into communicating with our visiting guests on how to be safe when they get here.
Thank you. Anybody else? Matt?
I can't, quick follow up on the plastic committee. At some point, I think we really should be talking about what are we doing at the landfill, and does what we're doing with the plastic dovetail with that properly or not? I think that's, I think it's a good intent. I'm following it here at my business, but I think the 5-10 year view should be looked into it. I think sometimes we try to do things because, they're politically correct, but they may or may not be sort of efficient. We may be just, if we end up, doing some type of incineration or some type of pyrolysis or some other process, we may find that we don't want compostables. We want the plastic in. So there's things there are things we still need to know before we keep pushing forward with some of these things, in my opinion. But that's for further study and further discussion. That's all.
I just have a couple of things that are coming up next week, that we're meeting with a new representative from National Grid to talk about Harbor Place on Tuesday. And then on Thursday, there's going to be a meeting to get back to talking about the next steps for the future of our island home. So it'll be good to get back to some of these items that we've put a lot of effort into, and try and move something forward. Is there a motion to adjourn?
So moved.
Second. All those in favor by roll call: Matt Fay.
Aye.
Christy Ferrantella.
Aye.
Jason Bridges,
Aye.
Melissa Murphy,
Aye.
Don Holgate, aye. Thank you very much. Good night.